Our second speaker will be discussing establishing occupational safety and health in the public sector. We have the Director 3 of the Human Resource Relations Office of the Civil Service Commission, Attorney Krunimar Antonio D. Escudero III.
Hello, everyone. Let me just share my screen. All right. Now, our topic for today is establishing occupational safety and health standards in the public sector. But before I go on discussing our topic, let me just tell you something about our office, the Human Resource Relations Office. One of the major thrusts of the Civil Service Commission is harnessing public sector unionism. So the Human Resource Relations Office, our office, is in charge of this major function of the CSC. And we are tasked to promote responsive management and responsible public sector unions, as they are both key players in ensuring effective governance. So the HRRO handles all concerns on public sector employees organizations in national government agencies, local government units, GOCCs, government-owned and controlled corporations with original charters, and local and state universities and colleges. Aside from public sector unionism concerns, our office is now increasingly involved in the formulation and implementation of policies, fixing and setting better working conditions. And one of those policies is our topic today, the JMC on occupational safety and health, standards for the public sector. So, the CSC DOH DOLE Joint Memorandum Circular number 1 series of 2020 on occupational safety and health standards for the public sector was published in the Philippine Star last May 7, 2020. Why is there a need for this policy? You see, the ever-changing workplace environment, which is affected by global trade, rapid technological progress, changes in work practices, and of course, the most obvious in our current situation, emerging health and safety threats such as a new virus or disease, types and patterns of hazards, exposures, and risks. So data on Philippine labor statistics disclose that there is an uptrend in terms of occupational injuries. In 2007, the figure reported on occupational injuries was at 48,977. This figure went higher in 2013 to 49,118. And the latest data that I have, the data in 2015, pegged this number to 50,961. So this data it tells us that there is a need to enhance and further improve existing working conditions in all government agencies. So why CSC DOLE and DOH? The 1987 Constitution and Executive Order number 292, or the Administrative Code of 1987, mandates the CSC to promulgate policies, standards, and guidelines for the civil service and adopt plans and programs to promote economical, efficient, and effective personnel administration in the government. So through this mandate, the CSC recognizes the importance of providing healthy and safe work environment for the government workforce. That is why even prior to the JMC, the CSC issued a number of policies pertaining to health and safety of civil servants. It promulgated MC number 38 series of 1992 on physical and mental fitness program for government employees. Also, Memorandum Circular number 30 in 1994, providing for the checklist of reasonable working conditions in the public sector. And we also have Memorandum Circular number 33 in 1997, or the policy on working conditions in the public sector workplace. So why the DOH? So the DOH, through Executive Order number 102, series of 1999, it mandates the Department of Health to promote the well-being of every Filipino, prevent and control disease among populations at risk, protect individuals and families, and communities exposed to hazards and risks that could affect their health, and of course, treat, manage, and rehabilitate individuals affected by disease and disability. As for the DOLE, no, PD 442 or the Labor Code of the Philippines mandates the DOLE to set the standards for occupational safety and health in different industries. Okay? Under the JMC, these three offices assume distinct but of course complementary roles in the implementation of the occupational safety and health standards in the public sector. The CSC is tasked to oversee the overall implementation of the guidelines, and this includes the integration of OSH subjects in the learning and development programs of government officials and employees. As for the DOH, it is tasked to establish a surveillance and monitoring of occupational injuries, diseases, and deaths in the public sector through its health information system. It is also tasked to develop occupational health service and benefit packages for the public sector and develop a toolkit as a guide for agencies in their implementation of the program. As for the DOLE, it has the most experience when we talk about occupational safety and health. So it is tasked to provide relevant OSH standards for the government sector, and kasama na dito, they are tasked to provide knowledge and information, data on OSH standards, programs, enforcement activities, and it should recommend mechanisms to harmonize the different OSH promotion campaigns with partner agencies. Okay, so the objectives of the policy are, of course, to protect all government employees from injury, sickness, or death while in the workplace. And through this policy, we aim to preserve human lives. We aim to preserve resources and prevent loss or damage of properties. And the policy will also guide government agencies in the development and implementation of safety and health standards in their respective agencies. To achieve these objectives, ano ba ang ginawa ng policy na to? So the policy institutionalizes, the JMC institutionalizes occupational health and safety in the public sector. Okay, and we also identified and clarified the roles and responsibilities of the lead agencies. Nabanggit ko na yung CSC, DOH, and DOLE, and clarify din natin yung roles ng heads of agencies, the role of safety and health committees, the employees organizations, the occupational safety and health officers, and of course the roles the vital role of the employees themselves. So, clarify natin yan dito sa ating policy. And the policy, more than anything else, requires the government agencies to have their respective safety and health committees. So, safety and health committees must be established in the national, regional, or local offices of the agencies within 6 months from the issuance, from the effectivity of the JMC. So ano ba ang composition ng safety and health committees? The chairman should be the highest ranking officer or highest ranking executive in charge of human resource. And the members are the head of agency himself or herself, or an authorized representative who holds an executive or managerial position. There must be, the employees must be represented, dalawa from the employees. From the first level and the second level employees. The agency physician must also be a member, and in the absence of the agency physician, any employee who is a graduate or who has a background on medical related course. Isa pang member should be a representative from the local risk reduction and management council or the risk reduction management officer or its equivalent in the agency. The designated occupational safety and health officer shall act as the secretary of the Safety and Health Committee. So yan po ang bumubuo sa Safety and Health Committee natin. So ano ba ang role ng Safety and Health Committee? The committee shall develop OSH policy and standards that is internal to the agency, no? Which should be in accordance with the provisions of the Joint Memorandum Circular. The committee shall plan and develop health-related trainings for the furtherance or promotion and accident prevention programs in the workplace. The committee must ensure the health promotion and accident prevention efforts of the agency is in compliance with government safety programs to maintain healthy work habits and safety practices in the workplace. It shall also conduct periodic safety meetings and reports. It shall submit reports of meetings and activities to the head of agency. Role din nila is to initiate safety trainings on OSH for the agency, and they shall coordinate with the appropriate agency. Those are just some of the roles of our safety and health committees. Yung complete list ng roles, you can just read them from our Joint Memorandum Circular. Okay? So ano ba yung scope ng JMC natin? So the guidelines on OSH, shall apply to all officials and employees in the national government agencies, state universities, colleges, local government units, and government-owned and controlled corporations, whether permanent, temporary, and or casual. So even job order employees, service, and individual contractors are included in the scope of the policy. So to do this, the head of agency shall ensure that institutional contractors or service providers have functional OSH policy and program which will cover employees deployed in government agencies. So what are the salient provisions of the JMC? Naka-highlight dyan yung good working conditions. Because of time constraints, I just picked this salient point, And of course, the JMC laid down the parameters and standards of what a good working condition in public workplaces should look like. What should be the minimum provisions in terms of working conditions? The policy also provided for the need to promote occupational safety and health in the workplace. And who are the agencies involved in their respective roles? I already discussed the roles of the CSC, DOH, and DOLE, some of their roles. And for purposes of improving the standards, there is a portion in the policy on reporting and monitoring evaluation. As you will note, the data I have mentioned earlier from the Philippine labor statistics deal with injuries in the public sector workplaces. So we need to gather information that is specific to government workplaces. Hence, the need for reporting, monitoring, and evaluation. The JMC also provided for administrative justice mechanism. This will cover violations of its provisions, non-implementation of the policy, and other incidents relevant to the JMC. And lastly, meron din tayong provision on the funding source. Now, we defined several items, 17 in all in the policy, but the most interesting for us today is the definition of working condition and workplace. So when we say working condition, we refer to the work environment and all other conditions that relate to that environment, such as work hours, yung hours of work, schedules, including rest periods, amenities, and health and safety programs. So with this policy, it is now very clear that in public sector workplaces, health and safety programs are very much part of working condition. Okay? So what is a workplace? A workplace, on the other hand, is defined as a place or establishment or agency where people are employed. But the definition does not stop there. The term clarified that workplace does not only pertain to work areas. It also includes other places in the workplace, such as the restrooms, classrooms, hallways, employee lounges, convention halls, the cafeteria, the quarters, no, if there are any, and it even includes office vehicles and shuttle services of the agency. So, what standard should we expect now in public sector workplaces? So, ito na po yun. So, the public sector workplaces should now have these important amenities, no? The building premises shall have adequate fire, emergency, or danger signs, globally harmonized systems, system pictograms, and safety instructions of standard colors and sizes visible at all times. Okay? Facilities, it must also have facilities for persons with disabilities, no? Para meron silang for their safe and convenient movement within the establishment, within the agency. The JMC also provides for good housekeeping that shall be maintained at all times. Example, cleanliness ng buildings, premises, the machines, the equipments, eradication of stagnant water, because these serve as breeding ground for mosquitoes and other insects, no? Dapat meron ding sanitary facilities like adequate comfort rooms, lavatories for male and female employees, and it should be hindi lang mag-provide, dapat well-maintained. Okay? Also, there must be a provision for personal protective equipment and devices, and it must conform to Rule 1080 of the OSH standard. Meaning, whenever applicable, the OSH standards for the eyes and face protection, respiratory protection, head protection, hand and arm protection, safety shoes, safety belts, no, lifelines, and safety nets must be followed by the government agency. Okay? Meron din requirement for indoor air quality management program, no, to prevent exposure of employees to hazardous environment and other conditions. Okay? And of course, there shall be a provision for health clinics and treatment rooms. Okay, now, integral din sa JMC ang emergency preparedness programs, but the establishment of the risk reduction and management system and the crisis management plan and contingency program shall be in accordance with Republic Act 10121 or the Philippine Disaster Reduction Management Act of 2010. So, Section 14 of the law provides that the public sector, no, employees shall be trained. So, be ready. Dapat trained ang ating mga employees in emergency response and preparedness. So, the training is mandatory for such employees to comply with the provisions of the Philippine Disaster Reduction and Management Act of 2010. Rule 10 din, Section 3 of the Implementing Rules and Regulations mandated the CSC to issue a directive requiring government agencies to provide trainings on DRRM for their respective personnel. That is why the CSC promulgated resolution, no, 18-00960. This was in 2018, and this was circularized through MC21 series of 2018. It mandated DRRM trainings, and DRRM, Disaster Risk Reduction and Management, shall form part, no, of the orientation of new employees. Kailangan din ng specialized trainings for employees specifically involved in DRRM. And DRRM trainings may be considered supervisory, managerial, or technical trainings depending on the contents of the module. So ano pa ba? Ano pa ang kailangan na meron tayo sa mga opisina natin? There must be occupational safety and health programs. So kailangan ma-establish itong mga minimum OSH programs, no? Dapat magkaroon ng occupational accident and illness prevention program, medical services assistance and rehabilitation program, occupational accident and illness surveillance program, and information and education campaign program. This all relates to, of course, occupational safety and health in our workplaces. Okay? So, next is occupational safety and health programs. Dapat ano ba ang nandyan? Dapat we should promote and practice health and wellness in the workplace as provided in those memorandum circulars. Under MC 38, dapat may 1 hour each week to conduct health awareness program. 20 minutes daily conduct of wellness or fitness program, delivery of public services must not be disrupted, of course. No? Under MC6 naman, we are mandated, agencies are mandated to allot reasonable time for weekly physical fitness exercise. We should include reasonable time to physical exercises to participants, no, in seminars and trainings. Okay? MC 38 and MC6 were reiterated in MC number 8 series of 2011. Okay? And yun, under MC 21, July was declared as Civil Servants Health and Wellness Month. So dapat magkakaroon ng mga briefing about fitness, health, and healthy lifestyle. Magkaroon ng one-day fun games. Dapat mag-serve ng nutritious food. No? And once a week, dapat may calisthenics or aerobics day. Okay? So we have to promote and practice health and wellness in the workplace. The JMC also provided for support facilities. Ano ba yung nakalagay dyan? Facilities which may be used for the promotion of health and wellness in the workplace shall be provided. So dapat meron tayong mga recreation areas. Dapat separate ang seminar and training rooms. We should have daycare facilities and drop-in centers. So, yung work assignments and good working atmosphere for improved productivity shall be provided to the following to the following employees with special needs, like pregnant women, older employees, differently abled employees, and employees with limited working abilities. Okay? There is also a requirement that we provide for lactation stations for lactating mothers. Okay? So the provision of lactation stations shall be in accordance with RA 10028 or the Expanded Breastfeeding Promotion Act of 2009. Okay? What is on working hours? So nandyan sa slide ninyo, sa slide natin that is flashed, the policies on or guidelines on overtime services shall be based on CSC DBM Joint Circular number 1 series of 2015, or the policies and guidelines on overtime services and overtime pay for government employees. Ano bang nakapalaman dito? Okay, so overtime services shall be authorized only when extremely necessary. Okay, kailan extremely necessary? When a particular work or activity cannot be completed within the regular work hour. Next item sa policy na to is the remuneration for overtime services shall be through compensatory time off, CTO. And yung payment of cash through overtime pay may be authorized only in exceptional cases. No, when the application of CTO for all overtime hours would adversely affect the operations of the agency. Okay? Nandyan din yung adoption of 4-day work week scheme in government agencies in Metro Manila. And it must be in accordance with CSC Memorandum Circular number 22 series of 2014. So ano ba to? Dapat if you are going to adopt a 4-day work week scheme, dapat yung frontline services can be accessed online. The agency must have a one-stop shop and functional call center or PABX telephone system must be established in the agency. And the agency must have a baseline data on performance, absenteeism, tardiness, and employee health and wellness, etc. You must have data on those. Okay? On work environment, no, kasama pa rin to sa reasonable working conditions, nakalagay sa ating JMC na dapat prohibited ang smoking at the workplace. So we should implement policies and programs relevant to this. So meron na tayong existing policies. Yung prohibition of smoking at the workplace is provided for under MC-17 series of 2009. As to drug-free workplace, we have the guidelines in mandatory drug testing for public officials and employees, no? That is contained in CSC MC number 13 series of 2017. So nakalagay doon, random drug tests shall be periodically conducted in an interval not to exceed 2 years. So nagagawa ba to ng mga ahensya natin? Okay? And etc. etc. Nandyan din yung tuberculosis prevention control in the workplace, yung about programs, no? Workplace policy and education program on HIV and AIDS. Okay? So isa pang importante na provision ng ating JMC is the promotion of occupational safety and health in public sector workplaces. So the agency heads, no, the heads of agency shall ensure the comprehensive dissemination of OSH information through a communication plan. Dapat may communication plan na gagawin ang inyong mga ahensya, which includes the publication of pertinent OSH information in the agency website, kung may website kayo, and other communication materials, no? And you must establish a feedback mechanism which shall be utilized to enhance the OSH program. Employees shall participate in the OSH information and education programs, trainings, and other related initiatives of the agency to contribute to the improvement and sustainability of the OSH program. No? Employees must be able to report OSH-related illness and accidents to the management in order for the management to act, no, and provide the necessary intervention. And of course, we are always for the enhancement of the OSH program in our agencies. Kailangan din mag-establish tayo ng network to support and sustain the implementation of OSH program with DOLE, DOH, and other academic institutions which can provide trainings, technical and medical assistance. And we must ensure that the OSH program and activities are included, no, in the annual work and financial plan of the agency. All right? So, and of course, yung funding source natin, the agency OSH, no? The funds needed for the implementation of the joint memorandum circular shall be included in the agency's regular budget and annual work and financial plan. I think this is the end of my presentation. We only have 20 minutes, and I hope I was able to give you the overview of this new policy on occupational safety and health standards for the public sector. Thank you very much, and thank you to the Occupational Safety and Health Center. We would like to emphasize that the Human Resource Relations Office of the Civil Service Commission will always be your partner in pushing forward the safety and health of our Lingkod Bayani. Thank you, Dole, and thank you everyone for your time, and thank you for listening patiently.
Thank you, Director Escudero.